Good morning everyone, I'm Dr. Inder from Hair Transplant Center. Today I'm going to do my patient of 27 years old, fully shaven FUE. So patient actually came to see me last year and asked me to do his hair restoration. So I told him to go on medication first, and then now his hair is better because of his young age, so I decide now to do for him this hair transplant. So what I'm going to do now is shortly I'm going to do the hairline, a very conservative hairline for his age of 27, and then I'm going to do the very conservative planting of the hair at the area that is lost. So you can see from the hairline to the crown. So his donor, if you look at his donor, so this is his donor. You see, he actually has shaved his hair, the donor very into number 1 before he come. Otherwise his donor density is alright. So today is fully shaven FUE. So as I'm doing the whole procedure, I'll be showing the steps of FUE today. So the method that I'm going to do is my favorite, of course, the John Cole instrument. So it's called a PCID to do the harvesting. And later the implanters and the blades and all that I'll be showing today. Thank you so much. So this is the photo room now for the preparation of the patient. So what we're going to do is we're going to take a lot of before and after pictures, and then we're going to actually take photos this angle down, and then we're going to do the preparation of the donor area where we're going to fully shaven the patient, and we're going to do donor marking shortly. So now patient is ready for harvesting. What harvesting means? Basically, harvesting means that we actually going to punch the grafts out. So there's many ways of harvesting the grafts out. So depends on the individual clinic. They use different kind of device. Here at Hair Transplant Center, we use the PCID machine to do the harvesting of the graft. So this is the machine. So you can set on the settings how you want the settings, and then you got a graph count there. Later as I do, the machine will give me the graph count. And also this is the handle. There will be the punch that I'm going to put in. I'm going to use 0.8 mm today because his caliber, the hair caliber is slightly thick, so 0.8 mm, but maybe later I will use 0.75 mm at both of the temporal areas because the hair is slightly finer there. Preparation is done. So before I really go into the whole process, I will do test grafts. So test grafts basically at the middle here, so to see where the hair follicles and the punch size, so it must be equal so that the transaction rate is not there. So before we really go on doing every harvesting, we do a little bit of test grafts at all the boxes to see everything is so correct, and then we start the whole procedure. Okay, so just harvest the half side of the side. So now we're going to do to the boxes on the right hand side. So basically this whole process is called harvesting of the grafts. So when we do FUE, we can actually see the grafts with the number of hair in each graft. So we can choose. Sometimes we take single hair, sometimes we can take double hair or triple hair or multiple grafts. So when you do FUE, you can actually look at the graph, and in each graph you can see the number of hair. So one graph may have single hair, one graph may have 2 hairs, or one graph may have triple or multiple hair. So in FUE, the specialty here is you can harvest the grass If you want a graft with a single hair, you can do it. You can harvest hair with double follicles or even triple or multiple. So you can cherry pick your grafts. There's many ways of doing planting the grafts. So you can do it by when you make the pre-made incisions, you can do it by blade. You can use the implanters, or in fact you can even use needles, band needles. Very individual, and then depends on the patient, depends on the scalp, depends on the skill of the doctor. In hair transplant center, I use needles, band needles for the very acute area. That is also normally for the temporal points and the temporal angles. So, and then today my procedure is a combination of the blades, pre-made incisions, blades which is 1 mm in size, and together with implanters. So I just make some pre-made incisions with the blades and then the implanters. So these are implanters, so this is the implanter with 2 hairs. So we have implanters for planting the graft, we have pre-made incision by blades for planting the graft, we even have band needles for planting the graft. So the choice of the type of methods is very individual, depends on the doctors.